Hey, good morning. It's Wednesday, July 27th. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Thanks for joining us on another Open Mics with Dr. Stites program. We're on Facebook, YouTube, and Twitter. Coming up today, a warning for new parents and those with children under the age of 6. What the CDC says you need to be on the lookout for. Plus, Dr. Dana Hawkinson will be along with the growing COVID-19 count here at the University of Kansas Health System. And speaking of COVID, this morning we are talking all about the growing COVID cases here in the metro and across the U.S. on this program. Joining us here in the Dolph Simons Jr. broadcast studio is Dr. Joseph LeMaster, the Medical Director and Local Health Officer for Johnson County, and also a family physician here at the health system. Patrick Salee, President and CEO of Vibrant Health, and joining us virtually, Dr. Carlton Abner, Associate Provost of Campus Health and Wellness at Kansas City University. Good morning to all of you. We will have our discussion in just a few moments. Questions from our viewers are an important part of this program, and we want to hear from you. Get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You'll find the links right there on your screen. The CDC has issued a new health alert for new parents. It's about a dangerous pathogen circulating around the U.S. called, I'm going to try and say this, Parakovirus. Pretty close? How close was that? Not bad.
On point.
All right, close enough. Joining us now to talk more about this is Dr. Mike Lewis, Medical Director of Inpatient Pediatrics and Pediatric Intensive Care here at the University of Kansas Health System. Dr. Lewis, good morning. He's also a great doc in cystic fibrosis, just in case you wanted to know that. Michael.
Good morning. So there's definitely been, this has been going around. The CDC issued kind of some updates at the beginning of the month, really, about noticing an increase in Parakovirus. And so that's definitely been on our radar. We haven't had the greatest data in terms of where all these cases exist at this point in time. Probably limited a little bit about the types of testing that is available for everybody, but we've definitely seen an uptick in it.
So the CDC, these cases of Parakovirus are a group of viruses that are commonly infect kids causing neurologic issues with seizures, meningitis, fevers. It impacts children ranging in age from newborn to 5 years. The CDC isn't saying which states have the infections, but they are saying they're most concerned about younger kids right now. Michael, how serious is it?
Well, there's actually a lot of people who get infected with Parakovirus.
So it's actually not uncommon.
It is not the most uncommon thing out there. This is not a new novel virus. This has been around for a very long time, so that's important to make sure that we clarify that. But one of the problems with it is there's really no great treatment for it. And so we know that there's definitely a percentage of kids who can get meningitis or encephalitis, which is a very similar type of approach where the infection is in the central nervous system. And so because it can impact these young kids and it can cause some developmental issues if they were infected from it, and we don't have any really great therapy for it, that's where all of a sudden now we become a little bit more concerned. So.
Yeah, and as I recall, I was trying to do a little bit of reading last night so I could be, ready for some questions here, but the Parakovirus is pretty common. In fact, 80% of kids by the time they're 5 will have had it.
Yes.
But this strain is causing a little more disease on the central nervous system than what it normally does. Is that fair?
That's absolutely right. And sometimes these kids also, even though they have a central nervous system infection, so kind of diagnostically what we would do is if that was a concern for us, we'd want to do a lumbar puncture and then kind of test the spinal fluid initially to see how much inflammation might be there. And not all of these kids necessarily show that sign of inflammation, which then adds a little bit of complication to it, as well as it can cause quite a bit of seizures in the younger kids, as well as it can make them pretty ill, not just like feeling ill, but like their blood pressures can be low. And about a fourth of these kids are going to require possibly a hospitalization to the ICU if they have meningitis from this virus.
And if I remember right, you helped me, it's been a long time since I had a pediatric rotation, but one of the reasons we do that is to do these tests, if there's really no treatment, is because sometimes with fevers, meningitis, seizures, it could be a bacterial cause instead of a viral cause, then we got to treat it.
Yes,
so we need
definitely.
to do that spinal tap.
Absolutely, yeah. No, if meningitis is going to be on the table as a possibility, we're going to want to do the spinal tap. And so whether you come to the emergency room or if you're transferred into the hospital from like an outside clinic who doesn't have the ability to do a spinal tap, then we would perform the spinal tap upstairs in the pediatric unit or pediatric ICU. And then we would just, what we call empirically, we start antibiotics. And because if you think it's meningitis, we're going to do some tests on that spinal fluid. While we're waiting for these results to come back, because not everything is instantaneous, we're going to start antibiotics to cover you in case it is a bacterial cause of the meningitis.
And really, there's not a treatment for Parakovirus other than time. Is that fair?
Yeah, time machine if you have one of those.
Yeah.
But unfortunately, there is no great antiviral medication for it. Sometimes these kids, when they get extremely ill, we've seen them actually get like IVIG, but that's probably to mitigate how ill those kids are, to kind of support them through maybe that immediate part of being ill, but it is definitely not something that's going to like decrease the amount of virus in their body at that point in time.
Okay, so time, it gets better. We have to make sure it's not a bacterial infection that we have to treat. But most of these kids, they make a full recovery?
Yeah, the vast majority do make a full recovery. But there is a very small percentage of these kids, it's less than one, who do have some kind of long-term developmental type of issues. And a lot of those things would be similar to anybody who has meningitis. It's not necessarily all that specific to Parakovirus. It's just we know that these kids can get meningitis from it. So hearing issues, some developmental delays that would require a lot of like PT, OT, and speech therapies along the way.
All right, last question. Well, I'll say it's the last question. We'll see. Dr. Lewis, what can parents do to help protect their kids?
It's probably kind of the same theme that you've maybe been talking about for a couple months now. Wash your hands. Don't go around others if you're sick. It's the standard viral infection control. If you're sick, don't go around others. Definitely don't expose yourself to brand new newborns. And, good hand hygiene go a long way.
All right. Thank you for being here today. I'm going to guess, too, early treatment because you don't want your kid to keep having seizures. So if you see any sign of seizure, get to the emergency room.
That's exactly
We can take
it.
care of those seizures, and that's going to help prevent long-term consequences. So.
No doubt.
All right. Thank you, sir. Thanks for
guys.
coming in today.
You bet.
All right. We appreciate always Mike Lewis. He was a great CF doctor, great doc here at KU. Delight to have him on the program. Hey, speaking of viruses, let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control here at the Health System. He joins us now to talk about today's COVID count. Hawkeye.
Yeah, hi.
How are we doing, brother?
We're doing better. A couple weeks ago, I was hoping that our acute infection numbers were going to be down. It had seemed that it had gone up. I don't know if that was when I was away at COVID Central or not, but certainly now, for today at least, and of course we're waiting for that 7 or 10-day trend, but for today, we have 28 active infections, so a few less than Monday. But 3 in the ICU, 2 on the ventilator, and 15 in that recovery period. And I know there are a lot of questions about recent deaths and vaccine status, and we are trying to get that. So we will either have it later today or Friday for people who are wanting to know that.
And Hawk, what we really know is that if you've been recently vaccinated or if you've been vaccinated and recently boosted as well, you tend to do pretty well. You don't really make it to the ICU. You're pretty healthy. For those patients whose vaccines are remote, or for those people who haven't been vaccinated, or maybe they were relying on prior infection and it's been 4 or 5 months, really you don't have as much protection against, especially with BA5, you're really at risk for more of a severe outcome, especially if you have more chronic disease and severe disease.
Yeah, I think that's the key, Steve. You're exactly right. We have good published data on this. I think there was MMWR a week or so ago looking at that, looking at 3rd dose, 4th dose. Those doses and being up to date, just as you said, really continues to provide good protection against hospitalization and death. So I think you're exactly right.
So I'm going to drive the producers just a little crazy here and say I'm going to mix it up a little bit because I'm going to first turn to Dr. Joe Lamaster because, Joe, throughout the Johnson County and what you're reading about Kansas, how are we doing?
Well, I wish I could say that we were doing better. I wish I could say we were, as many people saying, coming out of the pandemic. But the numbers are up higher than they have been since the Delta virus, or about the same as the Delta virus, certainly as high as they've been since the peak of Omicron in December. We're seeing, we saw a little bit of a lull immediately after the Omicron surge.
Which was very nice.
Which was good, and then everyone, including some national figures, said the pandemic is over, and
mistake.
Everything began to be relaxed, and everybody was going back to previous practices before the pandemic. And then we saw the rise of the BA4 surge, and on the very close tails of that, the increase in another further increase as a result of BA5. So our numbers are quite high now, being reflected. Also, we think that the numbers that we're actually picking up through the state health department and through the Johnson County Health Department are probably underestimates based on what we'll talk about a little bit later. Wastewater counts are showing quite a lot higher amount of viral presence in our wastewater than we're seeing even at the county. So it's quite high right now. There's a lot moving around out there.
Yeah, and I think we are probably benefited by a large number of people who have been vaccinated. We're going to talk a little bit more about that and how that's going in both Wyandotte and Johnson County. But Hawkeye, a new study published in this magazine Science shows coronavirus can find different ways to evade Paxlovid, the COVID-19 treatment. Are we seeing much of that? Because I know we prescribe it a lot. I've used it a fair amount for patients, and thus far I think it's been pretty successful.
Yeah, I mean, certainly the current collected data would suggest that as well. It continues to be successful, continues to offer that benefit of reducing your chance of hospitalization. Now, those reductions are, certainly decreased if you are fully vaccinated up to date. But even if you are and you have some of those other comorbidities, especially things like age, obesity, diabetes, heart disease, lung disease, it's still a good idea to get on Paxlovid. I don't think there are any other really data signals to suggest that if you meet that criteria for someone that should get it, you should still be getting it.
Yeah, I think that's exactly right, and I think people continue to respond. Some states are trying to say this is no longer a health emergency, though, that even though the pandemic isn't over, it's not quite the emergency it was. Makes me a little nervous, though, if we see the rise in BA5, knowing there could be other things out there, knowing that we are seeing a lack of boosters and going into arms, and if Paxlovid isn't quite working as well, and the monoclonal antibodies aren't quite what they were before. I just wonder, what do you think about all these situations? Are we setting up ourselves for some problems this fall?
I think we're setting ourselves up for problems if you are supposed to have a booster, if you are supposed to be vaccinated, if you are not up to date. Again, what we really have seen, and the best published data would continue to support this, that if you are not up to date with your vaccination, your risk does increase. If you have some of those other problems like chronic illnesses or older age, you are going to have that increased risk of hospitalization. So the vital part continues to be being up to date with those vaccines. And I know in a few weeks we'll be seeing what exactly the recommendation will be. We know that the vaccine companies, particularly Pfizer and Moderna, they will be having a bivalent or a 2-spike vaccine. One will be the original spike, because we know and we have seen that these vaccines that we are using right now continue to offer great protection, but it will also have that component of that second spike, probably from BA4, BA5. It's unclear exactly which one. I think it's going to be the choice of that particular company.
Yeah, interesting. It'll be an interesting time to see how these goes. Okay, well, we're back on the topic of COVID this morning, as you can see. Let's bring in our experts. Here again are Dr. Joseph LeMaster. You've heard from him, so thanks for being back on our program this morning. Patrick Salee, the CEO of Vibrant here in FQHC here in Wyandotte County, and Dr. Carlton Abner. Patrick and Dr. Abner, Wyandotte County has been in the medium to high transmissible rate for COVID for several weeks now. I see he says we're kind of in the red zone again. Just last week, the unified government officials in Wyandotte said that the current average is 60% higher than the rolling average of new cases per day recorded at this time last year. Yeah. What do we attribute that to? What people could do to protect themselves? Patrick, I'm going to start with you.
Well, I think you all talk about this regularly, and it's the same things that we've asked people to do since the beginning of this pandemic. And it's, we want people to get vaccinated, but it's also wear masks, keep your distance, wash your hands, as Dr. Lewis mentioned before. We're dealing with it feels like we're repeating some of the same things that we experienced in March of 2020, and it's impacting under-resourced communities faster and harder for the same exact reasons we talked about it in March of 2020.
Do you see people getting vaccinated? Are you guys still giving vaccinations?
We are still doing vaccines, and we're still doing boosters, and we're doing a lot of outreach events. So we still have a lot going on in community outreach related to the vaccine. One of the things that's concerning is we're not seeing as much demand for vaccine from parents for kids in the youngest age range. So we are out of 18 to 20,000 patients that we see annually, 15,000 of those are children. And so we expected and prepared for a big rush when the youngest became eligible and available to receive the vaccine, and we've just not seen the demand in that same way that we did when the vaccine first came out.
Yeah, I think that's a national issue for us. Dr. Abner, How are things at Kansas City University? Are people getting boosters? Are they listening? People all fired up about COVID, or is it like yesterday's news?
Oh, wow. I'd love to say that people are still fired up about COVID. I wouldn't say they're exactly fired up. There is an awareness, certainly, of the inherent dangers that are still present with COVID, but I would say our booster rates are probably reflective of the rest of the population, which might be somewhat surprising, for a health sciences university. However, we have the same people from the population that the rest of everybody else is pulling from. So in that regard, we're very similar. I would say our primary dose rates are significantly higher than the rest of the population, which allows us some latitude with some of the mitigation protective factors that we put in place. But yeah, I think there's still a need for awareness, and we certainly could do a better job of that even here at Kansas City University.
So what is your sense as far as wellness? I mean, that's one of your focuses. I know you've worked really hard at KCU to help develop that. And help us a little bit with that understanding the balance between, I want to pretend that it's normal, but I don't want to get COVID. How do we stay
Fantastic.
well?
Yeah, that's fantastic.
Yeah, I don't have an answer to that, by the way. I've tried to answer for 2.5 years. And yeah, I don't have an answer. I'm hoping you do.
Sure. Well, yeah, and we've got some unique populations that we're dealing with a very challenging curriculum here. Most of our students are medical students, so our College of Medicine is full of very high performers that can sometimes isolate in times of stress and want to double down on their studying and everything like that. So how do you get them connected, which is key? That's one of the biggest variables when it comes to wellness. How do you get them connected when you have things like mask mandates, can't really see nonverbal communication, or worse, when we have times where we've had to shut down in-person learning. So we are certainly trying to do our best to walk that balance as well. And what we're finding now is that pendulum swings back to some of the social factors that go into considerations when it comes to risk mitigation. Those social factors are more prominent, present in mind right now as we look at how to keep students well, as well as keeping them safe.
Yeah, that is an excellent point. All right, well, let's look at the CDC numbers of new admissions in the United States right now. Warning, they're going up again. This is some data we look at on a regular basis here at KU. Part of our team helps us compile this and pull it out of the CDC websites, and we look at it on a weekly basis. So you can see all the spikes, right? There's a beginning. If you look to the left of the graph and that you're facing, that's the original wave, and then it started to sink, and then we had another wave, and then we had the Delta wave, and then we had the Omicron wave, and now you can see another thing coming down. It's interesting. If you look at the rate of increase of this BA4-5, it kind of went from BA2.12.1 to BA4 to BA5. It's just this kind of slow rising tide right there. It's not the very sharp incline we've seen before. And I think most people I read, Hawker or Joe, are saying a lot of that has to do with the population of people who've either had the disease and have been vaccinated. And we just kind of roll through the population. And as your immunity begins to wane, boom, you can get BA5 because there's so much of it out there and it's so highly transmissible. So a lot of concern that wave is just going to kind of slowly ascend and keep going up. Fair?
Absolutely. I think the thing that is important to remember is that vaccinations still are number one most important protection against the virus. And while I think a lot of people are saying, well, I'm not vaccinated, I've had COVID before, I survived it, I didn't get that sick. It's really kind of unpredictable exactly what will happen if you get it again. And we know that the best thing to do, even if you get COVID, even if you have a breakthrough case, the probability of hospitalization and death is much lower in people who've been vaccinated.
Yeah, that continues to be true. It continues to be our data if you're vaccinated and boosted. Unless you've had a recent vaccination, okay, fine.
Yes,
but
yes.
it's really vaccinated and boosted or recently
yes.
vaccinated. Yep. Okay, so one of the things we're a little nervous about is that there's some prediction from the CDC that by mid-August, hospitalizations from COVID could rise up to 13,000 a day. Now, sometimes I think we got as high as the 30 and 40,000, but 13,000 a day is a lot. But how concerning is that to you guys? I mean, I think that from my standpoint, I'd say that's a problem because hospital beds right now are full. Our hospital is full, and we have, we only count the number of patients because we don't do every admission like we used to, but we are 40 or 50 or whatever the number is today. man, you push us up to 80 patients a day, you double that, and we're full. We're going to be back into a hard spot, I think.
Yeah, Steve, I agree. I mean, I think what we have seen, if you look at the cases, and I'm just going from for instance, the Washington Post, it's all freely available data, the Washington Post graphs. And if you look at that, if you look at the number of cases, well, the number of cases that we have seen has really kind of plateaued at a high level. Let's be clear, it still is a fairly high level. And those are reported cases because we know that people either aren't testing or testing at home, and those aren't getting reported. But it's been at a fairly high level. But what we have seen also, if you look over at the hospitalizations chart, that has continued to just slowly climb up. It hasn't plateaued yet. It hasn't peaked. It hasn't gone to that level that was in the Delta Omicron surge back a few months ago. But we know that it is continuing to rise. And as you do have more and more cases, even a small percentage of those that go to the hospital are large numbers. And then you have to expect also, unfortunately, if there are large numbers of people going to the hospital, you will have those deaths as well. And so I think that's what we're seeing. We're just continuing to see that rise in hospitalizations, no real plateau and no real peak, as we very clearly and evidently saw with that high surge of Delta and Omicron back in the winter.
Yeah, we can see that in some of our graphs. If we look at the next one, this is CDC's numbers of new admissions, hospitalizations in the state of Kansas popping up here. And you can see that rise as well. Looks just like the national graph. Rate of increase is a little more rapid. So again, a concern. You can see in the far right that number beginning to escalate, not as high as some of the other peaks thus far, but the slope of the curve is a little sharper than even the number of new cases, and partly we don't know the number of new cases because not all that many people are testing right now in public fashion. It's most of it's done at home. Hey, we should note Jackson County is once again requiring masks in county buildings because of the high COVID-19 levels. We're back to the same thing here at the health system. We're back to requiring masking all the time. And we have said that time and again why masking is so important. The CDC is calling for masking in counties where community spread is high. We don't need a mandate to wear a mask. You can make that own decision by yourself. But when and where should you mask? What would be your advice to give to the communities? Joe?
Well, the recommendations in this regard haven't really changed, even with the BA.5 and the other strains that we've seen most recently. It's most important to wear a mask when you are going to be in an indoor space with other people and you're not going to be able to be more than 6 feet away for any length of time at all. Especially indoor settings should be places that we're careful about. Outdoors, if you're going to be in a crowded situation where you can't space out, also in those kind of situations too. Also, I want to bring up something that I have continued to harp on at Johnson County over the last 3 years, is the other pieces of social distancing, apart from wearing masks and distance, is hand washing, the importance of frequent hand washing. We've talked about this before. It's very important before you eat, before you touch your face, after you've shook hands with someone else. Very important. This is, after all, at root, a cold virus, and so those sorts of things are also very important.
Yeah, and I would just say if you want to prevent Parakovirus, it's also another
yes,
way. We
yes,
heard at the very
same
beginning.
thing.
And I would
That's
say,
right.
sorry, I would
Please.
say that you're a good harper, and I think Johnson County is better off because of that. We need to continue. We know that overall throughout the country, infrastructures of public health are not what they should be, but you're a good steward to Johnson County and have always promoted those good messages. So I think that's important to.
And here's a question in
make
the
that
English
clear.
language, which is something I'm not familiar with really. Are you a harper or a harpist? Not bad, not bad. Okay, are you guys masking back at Vibrant now?
We are, and we've always had it within clinic. We removed it in sort of admin spaces, public areas, but that we brought that back a month and a half ago.
Dr. Abner, Kansas City University, what are you all doing?
In lab and clinical settings, we are requiring masks, and then outside of that, we are encouraging folks to wear masks for the CDC guidance.
Yeah, I think that's the challenge for us. Nobody really wants to do it all over again. I was sitting in a meeting with Tim Williams, who's not an infrequent flyer on this program, and he and I were talking the other day, and we knew we were going to go back to masking here, and we're talking, and he's like, I don't think you like to wear a mask. I'm like, you're right, I don't like to wear a mask. But I'm back to masking when I go to the grocery store. I'm back to masking when I go into indoor crowded spaces. I'm trying to eat at a restaurant. I'm trying to sit outside now. And I'm only working out outside when I go to the gym. If it's an inside workout, I don't do that. I go back home and do one. Because it's just, there's a lot of spread. And I think the thing is you have to decide your own risk categories. What have we always said from the very beginning of this program, Hawkeye? the rules of infection control travel with you. They keep you safe wherever you go, and it's one way you can make sure your own health is intact. I'm 62, got a couple of chronic health issues. My choice is I want to make sure I'm going to take care of myself and take care of my family. I think that's how we do it. All right, we know we have a lot of questions out there. Let's head to Studio B with Jessica Lovell. Hey, I got your last name right. Haha.
I love it. Good for you.
How about that?
Good morning. Good to see you. I want to get to a couple of reporter questions, if I can. From Fox 4 wants to know, cough syrup is in short supply. Have we seen an increase in respiratory illnesses other than COVID?
Have you? Huck. I was looking at you.
I don't know the
haven't
full
seen it as much.
epidemiology of overall, but yeah, we know that. We know that there were 2 separate surges of influenza this year. One most recently ending. I don't think we got hit too hard here in our community, but we know that has gone on. We know that other cough and cold viruses, we know there were surges in those as well, especially when the masking came off. So yes, now did we see necessarily the severe disease from these other cough and cold viruses? Not much. However, when I'm seeing those bone marrow transplant patients who have no immunity at all, we did see a fair number of those in the hospital this year as well. So there continued to be circulation. I don't know how much higher it was, but we know that they were circulating along with SARS-CoV-2 as well.
Joe, have you heard that from a county standpoint?
Well, we don't track specifically on that question, but one of the things we do track on are EMS, or emergency services transports for influenza or respiratory-like illnesses. And they are as high, maybe a little bit higher than they were this time last year. So that may give sort of an indirect reflection.
Here's what we know too. Remember, RSV had that spike, and Dr. Lewis and I were talking before he had to run out of the program, and he even noted this year they're not seeing that RSV that we had last summer. Remember how RSV kind of spiked at an unusual time, and like, well, we didn't have masks on, maybe we lost maybe, or we did have masks on, we lost maybe, whatever. And now we're not seeing that same spike. It's died back down a little bit. Influenza's kind of died back down a little bit. But we have to remember a lot of things are in short supply right now, and it can be a challenge of maybe there's a lot of cold and flu viruses. I'm not sure that's really the case at the moment, or there's a supply chain problem. We see supply chain problems throughout medicine right now, and we're bumping from one shortage to the next shortage to the next shortage. Now we have a dobutamine shortage, which is really an important heart medicine, but it's all about supply chain, and we're still interrupted from that standpoint. Okay.
Another question from Fox 4. Monkeypox vaccinations are starting to come to Kansas and Missouri. Who should be prioritized for this vaccine? Will everyone be recommended to get the monkeypox vaccine at some point?
Okay, I'm going to go look back to my left again to Dr. LeMaster and Dr. Hawk. Joe, how are you guys doing this in the county?
So the most important thing to recognize is that monkeypox, first off, is predominantly spread by prolonged close contact with another person. This predominantly happens during sexual contact, but can happen through other means, especially if the person has got open sores. And the people that we're prioritizing for vaccination right now are close contacts of somebody who is a known and open case. We're not, at this point, prioritizing nor promoting vaccination for the general population, even people that would otherwise be at high risk.
And Hawkeye, you and I were talking to Harley the other day. This is in the family of the smallpox virus, so smallpox vaccination can work. Talk to us a little bit about some of that, and antivirals.
Yeah, certainly, and I think that goes to the history of this in humans, and we haven't really seen a lot. However, since smallpox vaccination stopped in the United States in 1972 and other places as well after that, because the eradication of smallpox, as you have new generations now which have no immunity because of the vaccine to smallpox, you don't have immunity to monkeypox. Now again, this is not a new problem. It's a new problem for Western populations because now Western countries have this. But we should note that it's been in Africa, like the Democratic Republic of the Congo and Nigeria. They've been dealing with outbreaks since at least 2017, and it's been a problem for them. So it is not a new problem, but what we can do is really easily stop it, and that is by vaccination. Now there are, I think, supply chain issues, just like you talked about, Steve. There is just not enough supply of this particular vaccine, the Jynneos, which is the intramuscular vaccine, like you get the influenza vaccine or the COVID vaccine. It's just an injection. There's another vaccine, and I think we have over 100 million doses of that in the United States, but that is the one where they scrape your arm and make that scar. But we're not really giving that at this point in time. That is for especially bioterrorism emergencies. So what we're talking about really now is that one injection vaccine, and I think there's just a lot of supply issues. What do I think should happen really is to be able to vaccinate everybody, and I think that will give immunity to our population. But right now, just as Dr. LeMaster said, unfortunately, it is just for those high-risk people. Again, I think mostly due to supply chain and just having the ability and having that supply of vaccine. As the United States and other countries get more supply, it may be opened up for everybody to go ahead and get that.
Yeah, and I think that will be an interesting development. Something we have to track pretty closely is how this is going to fare. But as your point, you have to be in prolonged contact with someone who's got open sores. So the one way to avoid it is to not do that. The second thing is, you'd be like, well, it could be a respirable disease. Yeah, but it takes 3.5 hours to transfer from one person to another within 6 feet. So it's a prolonged conversation with someone who's sick or has open sores. And so, again, I think if you have open sores, maybe the thing to do is get tested, make sure that you don't have monkeypox and don't spread it.
And we know that, Steve, just like you said, the vast majority of all these patients that have it currently in the outbreak have had that close, intimate contact, that mostly that skin-to-skin contact there, and that's how it's being spread.
Jess.
Dr. Stites, we are getting a lot of community questions today, so I'm going to ask 2 right now, and then I'll let you get back, and then you can come back to me in just a bit.
Yes,
but
ma'am.
Mike KC, he's one of our YouTube viewers, he says, what are the chances we'll see masking return in school this fall? Will Dr. LeMaster recommend it in Johnson County?
Okay, you're going to be on the hot seat.
Yeah.
Here we go.
So we've had
I
a
got
lot
my
of
tape recorder going here, Joe.
I'm mostly, it's difficult to say what the Board of Commissioners will decide, because ultimately that is the decision-making body in Johnson County. We've continued to recommend the strong use of masks and all the other mitigation efforts strongly, and have never really changed our recommendations. But the mandates in the schools last year were predominantly due to the lack of availability of vaccine for the youngest populations. And so the commissioners wanted to have a mandate there because of that absence. Those kids were not protected. Now we've got the vaccine available right down to the youngest age group. The possibility of protection is there. We're not at the point yet of considering even the possibility of mandates. There haven't been discussion about that. But I would not anticipate seeing a return to mandate because, on the basis of what we had discussion about last year, given the fact that we've got vaccination. Rather, what we will do is strongly promote in every way that we can the uptake of the vaccine.
Yeah, my guess is if we saw a major outbreak again where teachers were absent, lots of absenteeism, it might make you think differently. Hopefully we're not going to see that, though.
Yeah, hopefully not.
Okay, Jess.
All right, Jean wants to know, what do we have to do to stop new variants from continuing to emerge?
Stop spreading the disease. That's really the answer, right? Because the new variants will continue to emerge as long as people are transmitting the virus. And so, Hawkeye, unless we're going to stop transmitting the virus, they're going to continue to come.
No, that's right. And Steve, what we don't talk about too much is that there are just so many immunosuppressed populations around the world for one reason or another. And I think that is there's a lot of evidence to support that is a lot of where a lot of these variants can come from. When you have continued replication of this virus within people for prolonged periods of time, mostly because of immunosuppression one way or another. So I think that's the key as well. I mean, there's just so much spread. But the other thing is that we know that there are animal spillovers that can occur and then occur back to humans as well. So you're just going to have so many opportunities for this virus to be selected out, for any one variant to be selected out. So I think we're for a long road as far as watching and monitoring for variants.
All right, let's go back to our discussions now. Joining us here in the studio are Dr. Joseph LeMaster, we've mentioned, Patrick Salee, the CEO over at Vibrant, and joining us virtually is Dr. Carlton Abner with Kansas City University. Patrick, Dr. LeMaster, we know testing our wastewater has been key during the pandemic. This next graphic is going to show us a little bit about what's going on with that wastewater testing, because it's kind of back on the rise. Does that make you nervous?
Well, Absolutely, and you know, if there was anything that I can say is that in our local area, we're seeing a rise in the wastewater rates that is above what we're detecting in reported cases. So we know that testing is underreported. A lot of people using home-based test kits, not reporting them to the state. So the wastewater gives us more of a picture of what's going on in the overall region. Recently, and we have a couple of wastewater plants that we track very carefully. And recently in Kansas, it's been higher even than what you can see in the national figures.
And I think the couple of points to be made here is that our region is lagging behind the U.S. If you look at the wastewater data coming out from parts of the country, it's peaked for BA5 and starting to decline a little bit. Ours is still, both Kansas and Missouri, is still rising. Some reports as much as up 40%. And I think, again, what it says is A, population of folks who haven't been vaccinated, B, people not being as careful, C, having to worry about how long it's been since you had immunity from whether or not you've had COVID in the past. So I think wastewater testing is an important tool because we don't have public health testing like we did. Yeah. We use the wastewater testing to really help us. According to COVID Act Now in Johnson County, 94.5% have received at least one dose of COVID vaccine, while 78% have received 2 doses or a single J&J dose. This compares, though, to only 71% getting 1 dose in Wyandotte. Patrick, I'm going to come to you for this, and 59% getting 2 doses. Okay, so first of all, Patrick, why is there such a difference?
I think that's a great question. I think some of it is skepticism. I think some of it is resources to get the vaccine out. But it is concerning that we are not caught up to Johnson County in terms of our numbers in Wyandotte County of how many people have received both vaccines, or even one, as their first data point says.
Dr. Abner, what can we do to reach into underprivileged communities, communities of color, whatever it may be, people who don't have resources, are non-public health? What can we do to try and get people convinced to get vaccinated?
That's a multifaceted answer to that. I think one of the biggest things is just restoring, rebuilding, continuing the trust that public health officials have already established for their profession within those underserved communities. And I think at this point, I don't know of a mass communication vehicle that is going to get you there. So it most likely is going to be establishing or reestablishing that trust, one person or a small group at a time. So it's going to probably require very intimate contact within those communities and conversations that are extended over a period of time to just get people across the line.
Man, I think that is so true, and we've struggled to get those messages out, Dr. LeMaster.
Yeah, I think that the thing that's definitely true. So one of the ways that we are working at the University of Kansas to try and get over those barriers, we have now a large agreement contract with the state of Kansas, with the Kansas Department of Health and Environments, and we are deploying through this program a number of community health workers who are out in the counties across Kansas working with those vulnerable populations, marginalized populations, building up trust. And that is in particular important for the populations that we're talking about here. And that's proving to be very effective. Also having a lot of input. We have local health equity action teams that are doing that work as well. So working together with CHW. So there are ways to get over this.
Yeah, and it is a big deal because we want people to stay active. A recent study in JAMA found that children and adolescents are 20% less active during the height of the pandemic. Mm-hmm. That's got to be bad for obesity health and all sorts of things, mental health especially.
Yeah, I think that the main thing that we've been trying to emphasize is the availability of backup programs, suicide prevention programs, mental health promotion programs, wellness programs across both in our health sectors and in the schools. And I think we're making a lot of progress with that. We've also had in Wyandotte County partnerships up there that go back as far as 2014 to increase the availability of those kind of services within the high schools. And I think that we're really seeing some changes happen there.
So, okay, Wyandotte County again, coming back to you. Vibrant is just so, I mean, your job, your whole thing is to work in right. communities of folks who don't have as much economic means. What are some of the things you guys have done to try and reach into different groups?
So we have sort of large scale, for lack of a better term, not quite the big event venue things we're doing in sort of the heart of COVID, but we have outreach events almost every day. We have vaccine and testing available for walk up at a couple of our locations every single day. We also have back to school events with the school district where we're offering vaccine to anyone in the family. We're every sort of well visit we have from patients, we're doing we're offering the vaccine and certainly testing if that's appropriate. We also have a partnership with the Unified Government Fire Department and that KU, the health system is part of, where we have a team, an EMT and an APRN that go out to individuals in the community that generally are homebound but make frequent calls to 911 or emergency room visits. And we're beyond helping them with the social support that they need, we're also trying to make sure they get access to regular ongoing primary care.
Yeah, those are all such important deals. Okay, so Jess, I think we're going to look back for more community questions. Any other reporter questions first?
No new reporter questions, so I'm going to jump in with some great questions from our viewers this morning. Ashley says, compared to other pandemics, how is COVID comparing in terms of active life cycle? Is COVID hanging around longer than other pandemics, or is it running a similar course?
You know, that's a great question. It requires a little reflection on history. We'd have to probably go back to the influenza or plague or other things, Hawkeye. But it feels like to me, what we're seeing in this is not that different than a lot of other severe pandemics. We're really into year 2.5, approaching year 3 of it. Influenza went for 3 or 4 or 5 years back in the late 1800 or 1918 to the early 1920s.
Yeah, I think that's exactly right. Like we said, 4 to 5 years probably for that. Luckily, we haven't all lived through very many pandemics at all. We know that the HIV/AIDS epidemic was extremely high, in particular in the early 80s and mid 80s. But for other things, and obviously these are different viruses spread different ways, I think the closest thing we can talk about is influenza, even though SARS-CoV-2 and influenza virus are completely different. But I think to your point, Steve, yeah, you're exactly right. Probably a total of 4 to 5 years. But we also have to understand our experience here in the United States is different than other people's experience in different countries, and we are seeing that every day, and we've seen that since the pandemic has began. So. And
Dr. LeMaster, I know you have to leave in just a moment, but 2 more questions. I'm going to have one. I think Jess has another one for you too. Okay. But you're also a student of history. I know that, and a student of medical history. So how do you see this pandemic versus other ones?
Well, as Dr. Hawkinson was saying, the one that we have the most information about in recent history is the Spanish flu epidemic of what occurred in 1919 and 1920. We know that in that situation, those cities that had instituted masking during that time were the ones that had the least amounts of deaths and hospitalizations, and we've reflected that as well. One of the things that happens with influenza is that it also mutates, and that we require vaccination changes from year to year. Back in at the time that epidemic was happening, that killed, I believe, 50 million people around the world, we didn't have the vaccines that we have now. We've been able to roll out a couple of really excellent vaccines and get them implemented into the population in record time. So even though this is a differently acting virus that is mutating quite rapidly, we're, I think, doing a pretty good job of keeping ahead of it. Plus, the infrastructure in our health system is strong and developed now. So I think that we're in a better situation than we were before.
Yeah, I think that's right.
And I think we also need to include the part about not just the virus and the illness, but just as you brought up before, all these topics are all so closely intertwined. Supply chain, and we have seen that play out as well. So all of these things are intertwined with each other. When is the pandemic over? How long will the pandemic last? I think you really have to discern what topics are you talking about specifically, because we have continued to see significant issues in supply chain and those types of things as well.
And just to say, in the Spanish flu epidemic, Kansas City and St. Louis had very different masking policies and had very different outcomes.
Yes.
Jess?
I know Dr. LeMaster needs to get going, but just maybe he could just give his take on this, because Isaac said he was looking at the New York Times database earlier this week and saw that half of the states were actually seeing declines in new cases. So in terms of their curves, how far ahead of Missouri and Kansas are their states? So how is Missouri and Kansas or Johnson County in particular, how do they compare to those states' curves?
Well, that's an interesting question. So as I've traveled around the country, one of the things that I have been able to, over the last year since things have opened up a little bit more, one of the things I've been able to see is that each of the states have very different ways that they're implementing the mitigation strategies. You've got, and that seems to be the main thing that is sort of leading this. If you've got a state where the mitigation strategies have been kept in place or largely kept in place, you've got less transmission happening in those places, or they're only happening where there's a lot of crowding happening. I think in our state and our counties, there have been less adherence, less willingness to have that kind of practice, at least at a legal level. And also when you're out in the county, you don't see a lot of people wearing masks at this point. So I think that the reason why we're not seeing our cases coming down is because we're not really, even though the recommendations are there, we're not following them as a population.
I think that's right. And I think what we're seeing is that, as we have with other pandemics, it started in some areas. Now the hot spots are really in the southeast and kind of in Kentucky. I'm looking at the heat map right now, southwest. We're not as much of a hot spot yet, but remember, our wastewater testing is still on the rise. Jess.
So Taylor wants to know, we've talked about the possibility, people have been asking, is there a possibility that the mask mandates may come back? So Taylor's just curious if our panelists believe that Kansas City will bring it back, but also what are the communication conversations like with public officials on bringing those mandates back? What are those conversations like? Or what
Let's grab Dr. LeMaster and Dr. Abner about this. Dr. Abner, I know you're part of Mid-America Regional Council, and you can talk to us a little bit about the MARC conversations.
Yeah, I would say, as we were saying earlier, there really right now is not a conversation about bringing back mask mandates. The main thing that is a difference between when we were having mask mandates is the availability of child vaccination. Remember that the last mandates that were in Johnson County were school-based mandates, and now all school children have the ability to be vaccinated. So I think that the conversation is going to shift from mandate of mask to vaccination.
Yeah, Dr. Abner.
I wholeheartedly agree. I think one of the most striking things about the increase in cases and hospitalizations that we're seeing right now is the uniformity and the lack of a conversation about going back to requiring masks. It's just not on the radar right now, and that's not terribly surprising. As we often do in science, when we have new data, we implement new approaches. And even though we're not doing what we were doing at similar case rates this time last year, what we have is just a totally different situation, as has been mentioned before, with the availability of vaccines, the availability of new knowledge, what works, what doesn't. And so right now we're just walking the balance between getting the right amount of information to the right people at the right time, and then allowing them to determine for themselves what individual mitigation protocols that they would implement.
And Patrick, if I think about the word in Wyandotte County, I'm hearing no real appetite for mask mandates in Wyandotte either.
Correct. Yep. I'm not sure they would call and ask my opinion if they were talking about it, but I don't think that's coming anytime soon.
And here's what I know. I mean, the last time we went around and had mask mandates again was largely driven by hospitalizations and hospitals getting really overcrowded. Hospitals are busy right now, but they're not overwhelmed with COVID. So I'm not sure that a mask mandate is going to really impact the situations hospitals are experiencing. If that changes and we see more hospitalization and deaths, you're going to get a different message from the local hospitals, because then we can't take care of heart attacks and strokes and all those things we have to do. If we can't take care of people, then we're going to say, guys, we need your help. We're not here. You're not getting that plea right now. Jess.
Few concerns about kids going back to school. Joe Ellen wants to know, what about the thousands and thousands of students returning to college campuses next month? Just what effect do we think, based on what we've seen as far as vaccination rates are going back to school, what do we think how that's gonna affect the numbers and what we might see?
Yeah, it's a great question. We were so prepared for that the last few years, Hawkeye, and it feels like that between having had natural immunity and having had vaccination, and I don't know there's going to be a lot of momentum to try and put a lot of masks back on college campuses unless we see things change once they've gone back to school.
I totally agree.
Question from Ellen. Would love to learn more about Vibrant Health. What services do they provide in Johnson County?
Okay, Vibrant is the best. Usually I'm given the Star Trek symbol, but this is V for Vibrant, huh? Patrick?
Yep. Well, thanks for the question. So Vibrant Health is a federally qualified health center. We operate 4 locations in Wyandotte County, Kansas City, Kansas. We offer medical, dental, and behavioral health services through all of those locations to about 18 to 20,000 patients. We take all forms of insurance, and we also have a sliding fee scale for people that don't have insurance that adjust based on household income. So we see ranges from newborns to adults. So all the medical, dental, behavioral health services you need outside of sort of specialty, where we partner with places like University of Kansas Health System and Children's Mercy.
So lots of kid care, adult care,
Mm-hmm.
primary care, women's care,
Absolutely.
OB visits, dental care, and
Yep.
some behavioral care. So
Correct.
That's
Right.
that's a really big deal.
Yeah, we don't deliver babies in our location, but we see moms up to 36, 37, 38 weeks.
Yeah, and we partner together around that. So it's great. Okay, Jess.
Cindy wants to know if you would talk about the polio case in New York. What does that mean?
Yeah, I mean, it's concerning. I believe, I don't know.
But polio's been around for a long time, and it's not we still get cases.
You know, we do. Most of them are from other countries. I thought this was believed to be from either the case was a person from another country who was unvaccinated. You know, we know that in other countries, when they do have vaccination programs, they are still using a lot of the oral polio vaccine. So then you can certainly shed that. It can get into wastewater. You can cause infections. We know that here in the United States, we don't use the oral polio vaccine. We use the injection, so that does not happen. But really, this should not be a problem. This continues to speak to the fact that it's vitally important that we maintain infrastructure for our public health and our medical practices, things like Vibrant, so that our children can get vaccinated against this in all of these childhood diseases as well. That's why it is so important to have these centers and public health places, county health departments, where people can go and get vaccinated and stay up to date with vaccination. It shouldn't be an issue. We know that polio virus, we probably could detect it in wastewater, but we don't want to do that. Why? Because most people are vaccinated against it. It's not causing any disease or any problems. This looks like it was probably from a patient from a different country. Again, we know in other countries also they're using oral polio vaccine, and we know that you can shed that. And sometimes it can revert to the disease-causing type of the vaccine, virus as well.
Just
I don't know
one
if
more.
that answered the question. But.
Yep, just one more question.
One more question. Last question's from Lindsay. She says, I heard the COVID vaccine will change to support the latest variant. This makes me want to wait for my kids who are under the age of 5 to get the vaccine and her booster herself. What's your advice?
Yeah, we're going to change, but we don't really know when it's available. I've been saying to people, if you're up for a booster, get your booster, and then we can get you the new one, the next one, late in the fall, which is, I think it's going to be out probably November, December.
Yeah, that's the best advice we can give. If you are due for a dose of vaccine, whether it's a primary series or a booster, you need to go get that right now. Will it change according to the variant? Possibly, but once this vaccine is available, and again, a bivalent vaccine, so 2 different spikes, one from the ancestral Wuhan isolate and one from BA4 or BA5. Once it is available, Stu, we don't even know if BA5 will continue to be around. We know that we've seen such rapid change in these most dominant variants as we for this latest surge as well. So if you are due to get a vaccine, whether it's your primary series or a booster, I would advise to go get it right now.
I think what the FDA is hoping, or the CDC is hoping, is that the next iteration will look more like BA4 and BA5 than the whatever the variant may be than it was of the original strain. And so having both spikes in there will keep you a little closer to what the next one's going to be, or the one after that. We don't know. It's a bit of a gamble, though, and that's what they're doing.
We don't know, because we know that if you've had 3 or 4 doses of the current vaccine, you still do make some neutralizing antibodies to BA4, BA5, although not in this highest titers or highest quantities to the other variants for sure. But what we don't know about any of these new vaccines is, what is their effectiveness at protecting you against hospitalization, severe disease, and death? And I think that's the data we really want. Is it going to be better than the current vaccines? We just don't know. I'm pretty sure it won't be any worse. But the vaccines that we have right now, if you are up to date, continue to do a very good job at protecting against hospitalization and death.
So you've noticed this tone in this program is a little more nervous than what we have been in the last few weeks around COVID-19. We had reached a great lull a while back, but now we've had to talk more about it. Our hospitalization numbers are clearly higher than they were a month ago or 2 months ago, and that doesn't even account for the fact we don't test everybody. If we tested everybody, we'd probably be in the 70 to 80 case count range. But that's not what we're doing today, and so but we're only testing those who are ill. What we do know, and the good news is, we're not seeing nearly as many as ICU patients and not nearly as many deaths. But it makes us nervous when we have 40 or 50 COVID patients back in the hospital, because that's a lot higher. So this Open Mics on COVID-19 is one of many we're going to be bringing you over the next few weeks. Join us on August the 17th, we're not waiting until September, as we talk about how school districts here in the metro are preparing for the school year with the COVID numbers still rising. You already heard a little bit about that today. We'll be doing more of that discussion then. Then on the 24th of August, we will talk about the growing number of people in the hospital with COVID here in the metro. We're in one of those CMO-like conversations. So you'll hear a lot about that. We're going to be focusing a little bit more back on it because the numbers are rising. We're doing a great program today. Let's get some final thoughts from our guests. Dr. LeMaster had to head out. Dr. Abner, thanks for joining us, and thanks for the great work you do at Kansas City University and all the great work on wellness in your fine school.
My pleasure, and thanks to all of you, and hats off to all the public health officials that we still have out in the communities working, and to you all in the clinical settings. Hopefully we can make your job a little bit easier by complying with some of the CDC guidance that we're seeing right now.
Thank you, and thanks for the great work on MARC too, Metropolitan Area Regional Council. People don't talk about MARC a lot. It's something that's kind of out there in the background, but whenever there's a challenge or problem, MARC is right there. They do a great job. I know you're doing a lot of great work with MARC, so thank you for that. Patrick Salee, final thought.
Well, thanks for having me on the program this morning. I think my final thought is going to be redundant to something you said earlier, but I think you all do a good job in this program of bringing it back to the basics of masking, hand hygiene, distance, and it's sort of as we go through these ebbs and flows of spikes in a new variant and spikes in COVID and hospitalization, all this stuff, I think everybody needs to remember to simplify it and go back to the basics. And that's what we're telling our patients every day. That's what we're recommending to people, same as what you all do every day. And I think it's important to remember to get back to the basics.
Thank you, sir. I bet you love the basics, Hawkeye. Final thought.
I love the basics. What are the basics? Be up to date with your vaccine. I think these are all good topics, and we will continue to be, just as you said, keeping everybody up to date on the latest news and cases. We'll try to get some more information on recent deaths and vaccine status as well.
We're not calling for a mask mandate again. We've done that. We've gone back to system-wide masking in both administrative and clinical spaces here. But that's not where we are in the public, and that's okay until it's not. Because when it's not is when we run the risk of not being able to take care of a heart attack or stroke or trauma or someone like that. So we all have to work to keep each other safe. Remember, whether it's a mandate or not, this is a community question right now, right? We're all in this together, and this is our community. And we know how to keep each other safe. BA5 is a problem. And if it continues to spread, and we continue to watch the rise in wastewater, it could be more of a problem. And then our message could become even more challenging. But for right now, what we're saying is, remember, the rules of infection control. What do? They keep you safe, and they travel with you wherever you go. If you go out and you're sick, well, don't go out when you're sick. Keep your distance, cough into your arm, or try to cover your face. Don't go out if you have a fever. And if you are sick, put on a mask. And if you want to prevent sickness, wear a mask. The rules of infection control. They worked in 1919 in the Spanish flu. They work today. They'll continue to keep us safe going forward. All right, we talked a little bit today about the value of masks and controlling COVID. We want to bring back, though, now an oldie but goodie. It would have been even felt better last week. Remember because it was so hot. Remember when we were in the freezer? Hawkeye and I did that to show you how effective masking really is. We're going to talk a little bit about that in just a moment. But also, don't forget to catch our programs anytime by logging on to Facebook, YouTube, and Twitter. A new procedure called intraoperative radiation therapy, or IORT. We're going to talk about that tomorrow for women with breast cancer. Tomorrow we'll go back and show you an amazing way it allows patients to go home after only one dose of radiation. A special encore episode. We'll be back here tomorrow, and we're live on Friday at 8 a.m. Make it a great day, folks.
A mother facing her toughest battle yet uses CrossFit to fight back.
This is what I feel like kind of keeps me going. I want people to know that I'm fighting, and I'm fighting hard.
It's been more than 2 years since Lisa Fosnoff was diagnosed with a rare bone cancer. How she beat sarcoma and inspired so many others. Friday at 8 on these social media channels.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now, everywhere podcasts are available.
This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. I'm back in the freezer with my good friend, Dr. Hawkeye.
Hi.
We're here to make a point about masks. Doc Hawk, he's got his surgical mask on. I've got a cloth mask. But you know, all masks can help keep us safe. And you can tell if you don't see our breath. We take our masks off, and what happens? Now we talk. There's our breath. We take a deep breath. Man, I've got your breath in my face.
My mask doesn't work well here.
What if we just put it under our nose? Does that really do any good? Not so much. So remember, let's keep each other safe. Let's keep our masks on.